For our final project, we will be speaking about cardiovascular disease, and it'll be presented by myself, Sadat, Stephanie, Jessica, Grace, and Christine. The project will comprise of a prevalence and burden section, causes and risk factors, prevention and intervention strategies, and lastly, a works cited page. So now let's go to prevalence and burden. Heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. Heart disease costs the United States about $229 billion each year from 2017 to 2018. This includes the cost of healthcare services, medicines, and lost productivity due to death. About 697,000 people in the US died from heart disease in 2020. That's one in every five deaths. About 20.1 million adults aged 20 and older have coronary artery disease, so that's about 7.2% of the population. And every year, about 805,000 people in the United States have a heart attack. About one in five heart attacks are silent, so the damage is done, but the person is not aware of it. Many individuals in the United States are unaware that they have a cardiovascular disease or at risk for one. This map from the CDC shows heart disease mortality rates by county in the United States. And as you can see, some states suffer more death by heart disease compared to other states. The states that are most affected, you can clearly see in the Mid-South to Mid-Eastern region of the United States. You can also see that some parts of states have very low mortality rates, while other parts of states have very high mortality rates due to heart disease. This can be due to many factors relating to social determinants of health, medical history, etc. It is also worth noting that the states that seem to have the highest mortality rates due to heart disease also have a very high Black and African American population within them. The table in the slide shows percentages of all deaths caused by heart disease in 2020, listed by ethnicity, race, and sex. Heart disease is the leading cause of death for people of most racial and ethnic groups in the United States. This includes African American, American Indian, Alaska Native, Hispanic, and white men. For women in the Pacific Islands and Asian American, American Indian, Alaska Native, and Hispanic women, heart disease is second only to cancer. According to the American Heart Association, Black adults in the United States experience higher burden of CV risk factors such as hypertension and obesity, and are more than twice as likely to die of cardiovascular disease relative to white adults. Similarly, American Indian individuals are 1.5 times as likely to be diagnosed with coronary heart disease compared with the white population. Individual burden. So, poor quality of life is usually related to high hospitalization and mortality rates. And these are the issues that individuals with cardiovascular diseases deal with at a high rate. So it can be inferred that individuals with cardiovascular diseases are more likely to have a poor quality of life compared to healthy individuals without cardiovascular diseases. The World Health Organization defined quality as life as an individual's perception of their position in life in the context of the culture and value systems in which they live in relation to their goals, expectations, standards, and concerns. Quality of life can be determined from the condition of physical, psychological, social relationships, and environmental aspects. And a full list of symptoms for cardiovascular diseases include dyspnea, fatigue, edema, difficulty sleeping, depression, and chest pain affiliated with cardiovascular diseases. These symptoms may limit activities of daily life. These physical and emotional symptoms may limit the patient's daily physical and social activities, resulting in poor quality of life. However, quality of life is subjective and it could be judged on a case-by-case basis. It really just depends on how the individual feels and views their situation. They can still work depending on how bad their condition is and what disease/issues they have. Usually though, they can somewhat work as long as they recover correctly and have healthy habits. It also depends on the nature of what the work is and how bad the injury was. And some common complications of cardiovascular diseases include heart failure, heart attack, stroke, aneurysm, peripheral artery disease, and sudden cardiac arrest. For our community, we chose Compton, California. The audiences that we are specifically targeting are the Black and Latino communities within Compton, California. We are targeting the Black and Latino populations since they make up about 98% of the population of Compton, according to the graph shown on the slide. We also wanted to focus on these specific populations because, according to the CDC table 2 slides ago, this one, Black adults in the United States experience higher burden of cardiovascular risk factors such as hypertension and obesity, and are more than twice as likely to die of cardiovascular disease relative to white adults. In the United States, heart disease is also the leading cause of death for African American and Hispanic men, while being the second leading cause of death for Hispanic women. Also, according to the 2020 MLK Jr. Community Hospital Community Health Needs Assessment, Hispanics are more likely to develop heart disease and suffer strokes compared to non-Hispanic whites. According to that same assessment, about 7% of adults in this community have been diagnosed with heart disease. It is relatively prevalent within the population, and there are most likely many more undiagnosed cases. There are many more undiagnosed cases of heart disease within the community. So we wanted to choose Compton as our community because after looking at this graph, we noticed that there's a significantly higher cardiovascular disease mortality rate in Compton compared to the rest of Los Angeles County. Compton has about 279 cardiovascular disease deaths per 100,000 people, which is much greater compared to the Los Angeles County average of about 205 cardiovascular disease deaths per 100,000 people. This intrigued our group to find out why this is and what intervention and prevention measures would be possible to implement. And every year, cardiovascular disease costs the United States about $229 billion. While there was no information I can find about cardiovascular disease costs for Compton, California, I was able to find information about the cost of cardiovascular diseases for Los Angeles County as a whole. According to the table shown from the California Department of Public Health, cardiovascular disease costs Los Angeles County about $13.5 billion during a typical year. Since the graph from the Los Angeles County Department of Public Health in the previous slide shows that there's a significantly higher cardiovascular disease mortality rate in Compton compared to the rest of LA County, we can infer that Compton greatly contributes to the $13.5 billion cost towards cardiovascular disease for Los Angeles County. Now, let's go to Stephanie, where she will continue speaking about the cardiovascular disease issue in Compton, California.
Now on to the current strategies, research, and surveillance information. Compton relies heavily on several strategies for research and surveillance regarding cardiovascular disease. For instance, they use the Callan Virus Screen 4.0, the California Department of Public Health Death Statistical Master File, and California Comprehensive Death File for LA County, the CDC Interactive Atlas of Heart Disease and Stroke, and the CDC Risk Factor Surveillance System. The Department of Healthcare Access and Information collects information on emergency department visits and hospitalization concerning cardiovascular diseases with the tool known as the Callan Virus Screen 4.0. Currently, this tool shows a represented rate of heart attacks per 10,000 people from the years 2015 through 2017. The shaded area on the picture here estimates 24.68 people per 10,000 in the census tract who visited the emergency department had a heart attack. The percentile for the census tract is 97.53, which just means it's higher than 97.53 of the census tract in California. They also rely on this master file as a form to acquire data on death certificates. The data includes indicators for life expectancy for cardiovascular diseases, and it can be used to generate a life table and the denominators for life expectancy and mortality rate calculations. So the graph here, which was previously mentioned by Sadat, is just an example of the data this source provides. According to the CDC Interactive Atlas of Heart Disease and Stroke, the graph here towards your left, it just indicates that Blacks who are 35 and older have a 311.2 age standardized rate per 100,000, with the national average for all races and ethnicities is 176.4 per 100,000. So according to the Compton General Plan for 2030, coronary heart disease is the #1 cause of death in the Compton Health District and LA County as a whole. Now on to the graph to your right. This is another chart for hypertension, and it shows that Blacks who are 65 and older have a 29.2 age standardized rate per 1,000 beneficiaries, whereas Hispanics indicate a 20.6 per 1,000. The national rate for all races and genders ages 65 and older is 15.5. So it just indicates that Hispanics and Blacks are the main targets for hypertension. Also, according to the City of Compton's General Plan 2030, indicates that 32% of individuals who are 18 and older have been diagnosed with hypertension, compared to 25% of LA County as a whole. Compton also heavily relies on the collaboration between the Robert Wood Johnson Foundation and the CDC to gather high-quality data area estimates for behavioral risk factors that can influence the health status and outcome of an individual. The CDC relies on a methodology called multi-level regression and post-stratification, MRP, which links geocoded health surveys and high spatial resolution population demographics and socioeconomic data to produce local level health related estimates. So according to the top image here, there's an age-adjusted prevalence rate, which just means it measures that controls for the effects of age differences when comparing across geographical areas, of 35.5 among adults over the age of 18 with high blood pressure, and the darker areas here on the graph indicate the highest percentage of individuals with high blood pressure, with a rate of 38.5 through 44.1%. Whereas the bottom image here corresponds to high cholesterol among adults who are over 18 and have been screened in the past 5 years. This is an age-adjusted rate of 31.5, and the darker areas here, they indicate a 34.3 through 36.7 of individuals with the highest cholesterol levels. The city does plan to use a surplus of health goals and policies to help reduce the prevalence of chronic diseases. For instance, they plan to partner with the LA County Public Health and create programs that will help delay any onset of chronic diseases among the city, and they plan to control the operation of alcohol-related businesses so they can help decrease the chronic diseases that are correlated to alcohol overconsumption. The city is also planning to improve local air quality by implementing policies and initiatives such as land use planning, transportation planning, and control of stationary emissions that can help decrease these issues. They also plan to transition the city to a more pedestrian-focused city, which will decrease traffic congestion and increase physical activity. It will also help improve the quality of air and decrease certain ozone pollutants that can lead to cardiovascular diseases. And the city has already placed restriction on the sale of flavored tobacco, as it does pose dangers of illness and death. The ordinance to ban flavored tobacco and menthol cigarettes was passed in June 2021 with a 12-0 vote. Again, the chart below here just demonstrates how smoking is a major risk factor for cardiovascular disease, with Compton having the highest death rate of 279.1 per 100,000 compared to LA County, which only had a rate of 204 per 100,000 of the population. Now on to causes and risk factors. Cardiovascular diseases are usually caused by unhealthy eating, inactivity, physical inactivity, usage of tobacco products, and overconsumption of alcohol. Individuals can experience elevated blood pressure, glucose, and lipids, as well as obesity due to certain behavioral risk factors. Genetics also has a factor to play in the potential of high blood pressure, heart disease, and other conditions. And there's a substantial increased risk when hereditary is combined with unhealthy lifestyles, such as unhealthy diet or smoking. So diet plays a large role in one's increased risk for heart disease. Eating a diet high in saturated fats, trans fats, and cholesterol has been linked to heart disease and atherosclerosis. So according to the European Society of Cardiology, eating the higher amounts of saturated fats has been linked to elevated low-density lipoprotein, or otherwise known as bad cholesterol. In addition, a high intake of saturated fatty acids can influence the pathways of inflammation and cardiac rhythm. Apart from diet, lack of exercise can also lead to heart disease and increase other medical conditions such as high blood pressure, cholesterol, and diabetes. Alcohol consumption can also raise blood pressure and increase levels of triglyceride, and tobacco usage can also increase the risk for a heart attack and heart disease, as it has the potential to increase blood pressure, and the carbon monoxide from cigarette smoke reduces the amount of oxygen that the blood carries, which ultimately damages your heart and blood vessels. As for hypertension, which greatly affects the population of Compton, especially Blacks and Hispanics, it can be very difficult to pinpoint the causes, as it can be a variety of factors, genetics, and environmental reasons, and that could lead to the development of hypertension. How much of it is preventable? Well, according to the Cleveland Clinic, it's estimated that 80% of cardiovascular diseases, including heart disease, can be preventable. Heart diseases and other cardiovascular diseases can be prevented by consuming a healthier diet that is low in salt and cholesterol, implementing regular exercise, and lack of smoking. It can also be kept up with doctor's appointments. One can gain insight on their overall vascular risk by checking their blood pressure, blood lipids, and blood sugar.
So, according to City Dashboard, the current population for Compton falls under 95,804 people. The social determinants of health for CVD would be social and environmental factors that contribute to the development of cardiovascular disease. Community and social features that increase the risk for cardiovascular disease include a lack of access to healthy foods, limited opportunities for physical activity, exposure to environmental population, and living in high stress environments. These factors can lead to high blood pressure, high cholesterol, and other risk factors for cardiovascular disease. In this slide specifically, I have included the community impacted by cardiovascular disease and social factors such as the clinical care, the percentage of individuals 18 years and over who get a regular routine checkup. 70.5% of adults in Compton reported visiting a doctor for a routine checkup, compared to an average of 74.1% across the dashboard cities, where 79% higher value indicate better outcomes. Followed by the obesity, which also is a risk factor considered for developing cardiovascular disease. Data shows that 35% of Compton's adults report being obese, compared to an average of 30.8% across the dashboard cities. Overall, Compton had a 387.4 cardiovascular disease deaths per 100,000 population, compared to an average of 211.5 across the dashboard cities. In terms of Compton, it is a predominantly low-income minority community that faces many of these challenges. Community medicine can help address some of these risks by working to improve access to healthy food and safe places to exercise. For example, building more community gardens and farmer markets can help provide fresh produce to residents, while community centers and parks can provide safe places for physical activity. Additionally, community medicine can work to reduce exposure to other environmental factors by advocating for stronger regulations and policies to protect public health. In this current slide, it shows that 32.8% of Compton adults reported being physically inactive in the past 30 days, compared to an average of 25.8% across dashboard cities. 15.8% of Compton adults reported smoking, compared to an average of 16.2% across the dashboard cities, and 30.6% of Compton residents had limited access to healthy food compared to an average of 65.4% across dashboard cities, meaning that population living more than a mile and half a mile from the nearest supermarket, supercenter, or large grocery stores. These are also factors that contribute to the increased risk of cardiovascular disease. So once again, upstream factors for cardiovascular disease in the city of Compton include objectives such as social determinants of health, which I was able to go over in some of the previous slides. Other factors in this category include poverty, limited access to healthcare, and inadequate education. These factors can contribute to downstream disorders such as hypertension, diabetes, and other chronic illnesses that also increase the risk for cardiovascular disease. Downstream factors for cardiovascular disease include lifestyle factors such as poor diet, lack of physical activity, tobacco use, alcohol, and stress. These factors contribute to the development of cardiovascular disease and other chronic diseases. To address these upstream and downstream factors, community medicine can work to improve access to healthcare, education, and social determinants of health. Additionally, community medicine can work to promote healthy lifestyle behaviors such as healthy eating and regular physical activity to reduce these risks that contribute to cardiovascular disease and also other chronic diseases. Attached, I have embedded a link to the local community hospital, Martin Luther King Community Hospital, where they provide community resources and ensure high quality care for patients.
Hi, my name is Grace. Christina and I will be going over prevention and intervention strategies. First, I will cover policy. The US ranks 34th in the world for life expectancy, lower than any other high-income country, and spends one of the highest costs on healthcare, nearly 18% of the gross domestic product. Chronic diseases are on the rise, and it is imperative to establish health policy that addresses rising rates of chronic diseases and addresses social determinants of health. The following are policy recommendations for advancing health and reducing the number of cardiovascular cases in the city of Compton. One is limiting the amount of alcohol being sold between the hours of 12 p.m. and 8 p.m. Second, we like to propose an increased taxation on all tobacco products. Smoking is a large risk factor for cardiovascular disease, and the city of Compton has a reported 12% tobacco use. We would also like to propose a sugary beverage tax so that there is a reduced consumption of sugary drinks that are less than 100% juice to then further reduce caloric intake. Next, we like to establish or recommend a food policy initiative. This would include an increase in expansion on CalFresh benefits so that there is an increased access to nutritious foods and expand benefits to cover healthy prepared meals. We're also calling for a pause on any new fast food restaurants and increasing fresh, affordable meal sites like Everytable. We would also like to propose a healthcare policy initiative, which would allow for an increase to healthcare by the following measures. One, utilizing Compton's local community centers as community clinics and include after hours and weekend care, provide for use of mobile clinics and establish regular routes throughout the Compton neighborhood. Two, we would like the initiative to also adopt health education with a focus on prevention of cardiovascular disease and other chronic diseases with the use of community health workers. And lastly, in this healthcare policy initiative, we would like for nurse practitioners to have full practice authority to address the shortage of physicians and to address the health needs of the community. One of the last policy measures that we are recommending is the physical activity policy initiative. Compton residents will be entitled to free local gym memberships to encourage the physical activity, and the city will also increase green space and walking paths for its community members. Next, I'll be covering community infrastructure, school, and workplace. These are changes that can be made or improvements that can be made in each of those areas. So first we'll start with community. We believe that it is important for every community member of Compton to feel supported in their health journey. This requires that the city put together a plan to support and encourage a healthier lifestyle. The following is our recommendations. 1, increase green space. According to the U.S. Green Building Council guidelines, cities should have a minimum of 121 square feet of green space, not including schools, per person. The city of Compton has a total of 118 acres for a population of around 100,000. This is roughly about 52 square feet of green space for Compton residents, below half of the recommended guidelines. 2, we want to provide a recommendation for increased access of pedestrian-friendly and bike-friendly paths. Increasing paths allows for community members to have access to driving alternatives, which helps the environment and limits the carbon emissions. Along with this, we would encourage well-lit paths for added safety. We would also recommend to clean and beautify the Compton Creek trails. Third, we would like to recommend access to healthier food options. Just as we mentioned in the previous slide, the city of Compton holds a farmer's market once a month. We would recommend for a weekly farmer's market to include a variety of fresh food options and allow the use for EBT and WIC as a source of payment. We would also encourage increasing community gardens throughout the city. Currently, only one community garden has been identified in the city of Compton. So we will really want to make sure we can increase this. Lastly, increase community awareness through health education. We would recommend that the city adopt ongoing community health education across the city regarding cardiovascular disease and other chronic illnesses. School. So these are the improvements that can be made in the school setting and also some changes. As we know, healthy students make for healthy adults. The Compton Unified School District serves 26,000 students and has 36 school sites. The school district can ensure that each student is provided with the following: healthy food options. We all know what cafeteria food looks like. We want to make sure that there's less processed meats and more plant-based foods and more fresh produce. We want to increase physical activity, provide opportunities for learning and engaging in a variety of activities and exercises such as yoga and dance. We want increase and improve health education across all school sites and continue with drug, alcohol, and tobacco prevention programming for K through 12 students. Lastly, work. We're going to address work changes and improvements that can be made in the city of Compton. Individuals spend more time during the week at work than at home. It is important for employers to understand and recognize the importance of a healthy workforce. Investment on staff in terms of health not only keeps your staff healthy, but it also increases work productivity and retains employees. Employees in the city of Compton can work with staff to develop and adopt a health and wellness-friendly work environment. This will encourage healthy behaviors and yield higher job satisfaction. The following are some examples that can be offered at work. Offer healthier food options, perhaps replacing vending machines with fresh fruit bowls. Also include water stations to fill up water bottles, and again, encouraging an increase for water intake. Develop a smoke-free policy where smoking is prohibited anywhere on the property. Encourage physical activities. Examples include having walking meetings rather than sit-down meetings. Include point-of-choice prompts to encourage taking the stairs rather than the elevator. Install bike racks. Hire a fitness coach on site to meet regularly with your staff. Lastly, offer incentives like reduce insurance premiums for yearly physicals and also include free gym memberships for your staff members. I just want to say this. Currently, the city of Compton has a request for proposals in preparation for the 2040 general plan. We encourage you all to get involved with this process. This is when you can add your voice into what you feel might be adopting healthier measures for your city. Next, Christine will be talking about social and individual intervention strategies. Thank you so much for your time.
Hello, my name is Christine, and in the prevention and intervention strategies, I will be discussing social, community, and individuals. So some changes in social perception and behavior that would help reduce stigma and support interventions within this community includes understanding individual differences in the way we obtain information about cardiovascular disease, such as reaching out to our primary care physician or finding community outreach resources that can help get educated on cardiovascular disease. For healthcare professionals, we have to use a relaxed tone of voice when listening to patients that are reaching out to us to discuss their health and seek professional guidance. And we must remember not to make any judgments regarding others based on their characteristics or life choices. This would matter to patients and their families because patients will be more willing to disclose information and seek education and treatment that they may need. The physical and mental health of the patients and their families will be monitored, making them feel to take on a sense of accountability for their actions. Some recommendations for the community to make these changes happen include the individuals in the community should link to community-based services and clinical services on intervention strategies. Some intervention strategies can include any lifestyle changes, cardiac rehabilitation, medications, and/or surgical interventions. The community may seek guidance from their primary care physician on any prevention strategies. Prevention strategies may include primary, secondary, and tertiary prevention. Primary prevention includes disease prevention before it occurs, such as eating healthy and exercise. Secondary prevention includes a reduction in impact of a disease that has already occurred, such as checking blood levels or glucose levels to manage the disease and prevent any complications. And tertiary prevention includes a reduction of the impact of an ongoing disease that has lasting effects, such as medication or injections to improve the quality of life and prevent long-term discomfort and problems. So moving on to the next slide. So how can individuals take responsibility and control of their risks? So they can track their medical record to make sure they are up to date on health assessments, vaccinations, and other health needs. Individuals can engage in policy change, such as partake in community programs that focus on decreasing cardiovascular disease. For social circles, the individual must surround themselves only with those who may influence positive choices. How the community should help people make these changes. Access to places for physical activities, such as building sidewalks, trails, or offering available public transit infrastructure. Mass media campaigns can relay messages from trusted sources on health information. Outreach programs can reach out to community members and inform them of the dangers of cardiovascular disease. Health screenings, health fairs, or physical activity counseling can be offered to individuals at little to no cost. Some likely obstacles to the individual responsible for change may include work stressors or family problems or self-obstacles. So how to overcome any likely obstacles can include, for work stressors, encouragement of prompts to promote physical activity or provide wellness programs with incentives for employees, such as meditation, massages, or counseling. For family stressors, there could be communication with the importance of maintaining behavioral changes in physical activity or proper nutrition to build a strong support system for the individual. And for self-obstacles, it could be any self-reward or reinforcements, any problem-solving behavior change maintenance, and utilization of resources. And that concludes my slide. Thank you.
Thank you so much for tuning in to our final project. And if you have any questions, comments, concerns, you can email any one of us in the group. And here's a link for the CDC where you can learn more about heart disease and resources for healthcare professionals. And here's just part 1 of our reference list, part 2 of our reference list, and part 3 of our reference list if you're interested. And thank you so much.